Hi, everybody. Thank you so much for joining us today. My name is Angela Love Zarenka, and I have the great privilege and honor of introducing Nikki and Nikki, lactation career consultants, and their topic today on COVID Q&A with Who Said What? So, Nikki and Nikki, thank you very much for joining us.
It's
Thank
good to
you
be
for
here.
having us. Hey,
Yes.
everybody.
Hey now. We should probably start with the warning that
Woo.
both Nikki and I are in some sort of tropical weather situation. So
Yes,
if we
but we're
freeze or
both.
disappear, uh,
Right,
just
right. We're queued up with some audio, so at least you're gonna get that. All right.
yes.
Hope everyone is well and safe, and we have a really hot topic for today. I feel like, even in ourselves, we've been going back and forth just talking about it. So I foresee a lively discussion, and we really encourage y'all, if you have questions or comments, please put them in the box, and we will say them live and talk about them. All right, so let's
Yes,
get in it.
join the conversation. Let's do it. So I am Nikki Killings, one half of Nikki and Nikki Lactation Career Consultants, also private practice IBCLC and Director of Equity, Inclusion, and Belonging at LER. Thank you, LER. Shout out for making this possible. All right.
Yeah, woo. I am Nikki Greenway. I'm the other half of Nikki and Nikki. I am a family nurse practitioner and IBCOC in private practice, or I have a perinatal practice, but also includes lactation here in New Orleans, Louisiana. So welcome everybody. We would love to hear where y'all are from. So put in
Ooh,
the chat where you tuning in from, and
yes.
give us a good idea of where we're reaching and the type of situations that you're going through. Like if you're in Florida with Nikki Killings, your state is like a whole country right now with COVID.
Indeed.
Lost your
Indeed.
mind
Outranking
and
most
lost your
countries
mind.
in the world.
Outranking most countries.
We're winning.
And you good job. uh, and please, we love to hear where y'all are from. So please drop it in the chat and let us know. So let's dive into it. So just a quick check in, Nikki, how
Yes.
are you doing?
Um, this has been a strange morning, and I think you probably can relate. There's been a kind of a thing after thing has come my way, and things are unsettled with a lot of
Mm-hmm.
folks that we're supporting and seeing and consulting on right now. But I am well. I'm thankful for my health in the middle of Florida, who is winning.
Right.
Florida is
Who is
winning in
winning?
so
Is
many
winning.
ways. Um, and just try my best to make sense of how to best take care of the community that I live in now, in the middle of a lot of folks really don't really think this is real yet, despite the
Right.
numbers. There's a lot of
Mm-hmm.
Florida, there's a lot of suspicion and doubt, and a lot of things we have to combat to even get to getting people to wear masks and protect themselves. So in that type of environment, figuring out how to best and safely see clients is a difficult thing. So I'm trying to figure it out. I don't know. I'm good in a nutshell. How are
Yeah.
you?
I'm okay. Yeah, today has been an interesting morning just with patients and stuff like that. But I also think as I've gone back into or slowly gotten myself into doing home visits again, now our numbers are going up substantially. Louisiana is about to hit 100,000 cases pretty soon here. And now we kind of have to pull it back. And the parents are like, but no, I need breastfeeding help. And our hospitals are kind of took off the visitor. They added on the and one. And now you got to take away -1. And they're not getting all the support they need. So it kind of puts us in a situation of, okay, let me take a step back and kind of reconfigure how we were thinking about providing support. But then also throughout this whole time, even like especially here in New Orleans, we've been getting into these WHO code situations that have, as an IBCOC, it kind of makes you pause, and others look at you and they're like, well, you're IBCOC, you're supposed to be adhering to this. But we want to dive into how we deal with the WHO code in our practices. and what the literature says,
So
what it
a
is and what
great
it
point.
ain't.
Great point. Can we begin at the beginning for those? There are some folks who are new to practice who don't even
Right.
know what the WHO code is or what it means. And there's some folks who
Mhm.
are seasoned in practice and maybe have
Right.
an impression of what the WHO code is that is not exactly, accurate. So,
Right.
if we had to sum up what the WHO code is, how would we do that? Let's see. I'm gonna go to the actual definition of it now while we're here. But we're also going to talk to you about what it kind of means in layman's terms,
Mhm.
right? So what is it? What does
Right.
it mean? Who is it even for? Anybody know?
For the hospital.
For the hospitals. For the,
So
it's
so
not
for
it's not for
me,
parents.
I think of it as like, oh, that's something that the organizations, businesses, and stuff are adhere to. Hospitals are supposed to adhere to. I would love for the homeless shelter down the street to adhere to it. But for them, they literally said, "Who said what?" That's what they told me when I talked to them about the hookah.
Yeah, yeah.
So,
Yeah. All right. So here it is. I pulled it up. Thank you. It says the WHO code, of course, WHO stands for the World Health Organization code, is a short name for the International Code of Marketing of Breast Milk Substitutes, which was adopted by the World Health Assembly and UNICEF in 1981. Since that time, there's been a number of resolutions, but this is the original. So the code is a marketing code that aims to protect breastfeeding, to protect all mothers and babies, whether breastfeeding, formula feeding, or combination feeding, and to prevent aggressive marketing practices that often prevent mothers from meeting their own breastfeeding goals. Infant formula, feeding bottles, and artificial nipples are the main products that fall within the scope of the code. Pacifiers and breast pumps are not under the scope of the code. Note that the code
mhm.
only applies to marketing of those items and not whether or not they are sold or used. Hmm.
Right.
Hmm.
Right, 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 right. So here's the thing. So the WHO code is not directed at parents. We didn't hear anything about parents. We didn't say it does not advocate against parents choosing to use formula.
Nope.
Didn't say anything about that. Nope. Doesn't require that parents be given complete and factual information about infant feeding. It
Nope.
does require them to receive all these things. Okay.
Yes.
How to properly and prepare infant formula. It does
Yes.
require that. It does require that. It does not suggest that formula sales to the public should be limited. It
Nope.
doesn't say anything about the grocery stores. It doesn't require that infant formula. It does require that infant formula meet strict quality standards. Okay, we're not out here giving anything that they have to have safe preparation, clear instructions for safe preparation, has to have appropriate labeling, and all those things. It does say that companies should stop marketing practices that undermine breastfeeding and
Yes.
prevent mothers from meeting their breastfeeding goals. And lastly, it does say that instead of advertising hype, parents who use formula should have received unbiased factual information.
Hmm.
So, in looking at that and thinking about your practice and what you've heard about the WHO code, because I've been heard things like, oh, you can't have those pumps, you can't those breast pumps, or you can't have this company is not WHO code compliant, so you can't have their stuff. If we really look at the code from 39 years ago when it was created, it doesn't really say anything about that
It
unless we've
doesn't.
had seen so.
No, and I think that that's the point we want to really clarify right here as we launch into the discussion is oftentimes I know I have and Nikki, I think you said that you have as well been told that we're going to be reported or told on for violating the
Right.
code. It's not a thing that an IBCLC can do. We can't violate the code unless we're creating marketing pieces that advertise.
Mm-hmm.
We can, however, partner with non-code compliant entities. So that is a
Right.
part of it.
That's a
But
thing. That is a thing.
in supporting families and supporting all types of infant feeding, which is our role, and helping them to do so in a healthy and safe and evidence-based way, it's there doesn't really create itself an opportunity for me to violate the code, the marketing code regarding breast milk
Right.
substitutes. And so we want to be really clear on how this works. It's not marketed towards parents, or not geared towards parents. Parents can't get in trouble. And if we're being really
Right.
honest, nobody in the U.S. can get in trouble because the U.S. didn't sign on to it. So there's
Right.
that.
Right. If we're being really honest. But also, like I've been, people are, oh, Nurse Nikki, you're teaching. So here's the thing about our clinic that we have, the New Orleans Breastfeeding Center. We're an infant feeding clinic. So we also help formula feeding families because we know our area. I know what Louisiana does. Louisiana does mixed feeding. We are number 49th in breastfeeding. So we can't just go straight from, we're going to teach them how to breastfeed, we're going to breastfeed. We're not even meeting the families where they are. So yes, I'm going to teach you how to safely use this formula because that's my job. And if I didn't and just left you off and doing something else, then I wouldn't be doing my job. I wouldn't be doing no harm. So I feel like I am required to do those things. And Nikisha and I were talking about it, like breastfeeding is kind of, it holds a level of privilege with it to
Of
exclusively
course.
breastfeed your child 8 to 12 times in 24 hours. There, all the skies have to align. There has to be all these things set in place for this family, for this parent to sit down and breastfeed their kids. So we have to know that sometimes our families will mix feed, and I have to be able to support them. And I have been criticized in the past. They're like, "Well, Nikki, is that aligning with Fed is Best?" No, that's aligning with Common Sense is Free because I don't want these families to die.
Feed the baby.
I
Feeding the
know
baby
that
is the
their
first rule,
priorities,
right?
right. I want them to be able to live. And this one is worried about eviction notice. During this time in COVID, people are being evicted from their house. I have a mom, she's 22 years old. She is leaking breast milk. I said, just bring the baby to the breast. She's like, Nurse, I don't have time for that. We're about to be evicted. I have to pack up these boxes. Like, I have all these things. And as much as I want to breastfeed my baby and she has copious amounts of milk, I have to be realistic in that I'm not about to push you to do something that's not conducive with your lifestyle. So let me help you figure out the best plan. And we have to be fluid with that. And sometimes we are hit with the code from other people, like, oh, are you going against the code? I'm going against the code of what is common sense for my community. So
Supporting the families first, getting the babies fed first, right? Now let's be clear. We
right.
respect the code. I think it is absolutely necessary.
Absolutely.
There's a lot of
Absolutely.
discussion about whether it makes sense right now, whether it makes sense in countries that are privileged and where access is great. I think it does have a place. I think it is really important to not market breast milk substitutes in a way that's dishonest, deceitful, confusing, manipulative to those families who are in their most vulnerable time of parenthood. Absolutely, full stop. No question about it. However, if we're not talking about predatory behavior, if we're not talking about trying to trick them into believing that substitutes are as good as the real thing, as good as breast milk, if we're not doing that, if we're simply talking about making it available to a family that has to make a difficult choice to mixed feed, to use a pump if necessary, to again the pumps are even mentioned, if a family has to make a decision to not exclusively breastfeed, and it is the best decision for them, and whatever they decide is the best decision for them, we respect them and their choices.
Right.
Then our job is to support that decision the best that we can as the feeding specialist, right? Full
Right.
stop. That's it. Now, the
That's it.
predatory practices absolutely happen, and there's a reason why. That's why the code is important, because those families who uh, don't have the information, don't have access, to lactation support, like you
Mhm.
who are listening, those families are vulnerable to misleading advertisement. Oh, just as good as mother's milk, whatever. You've seen it all. We've all seen it on the
Right.
canisters. And even as much, I've heard even talk about the way that the formula is locked away in stores gives a perception that this is really valuable. this is something I
Mm.
need. You know what I mean?
Mhm.
Building those perceptions around that stuff gets a little tricky, gets a little muddy, and I'm all for getting rid of anything that is going to be deceptive to parents that need clarity and information and support more than anything in those first weeks.
Absolutely.
Absolutely, absolutely.
Yeah. Yeah. And we've experienced some of those the predatory marketing. It happens on a day-to-day basis, right? And so those things with baby-friendly hospitals, how they've reined in a lot of that under their guidelines of, you're not getting your little bags anymore. I still have the moms come to me. I had my baby 8 years ago. What happened to that bag? Now I'm pregnant again. I'm like, yeah, we're not doing that anymore. That is leading, leading the parent, as I like to call it. um, so things like that. But think about right now during COVID, what has happened at the beginning. Remember, and maybe this didn't happen in your space, and maybe it's just happening now. But for us in New Orleans, at the beginning, they were like, formula is running out. They were all on the media here, on the
Mm,
news stations, the WIC offices. We're short on Nutramigen. We're short on Alimentum. We're short on all these things. And not one time did anyone say, hey, continue breastfeeding your baby. Breast is, and it took the New Orleans Breastfeeding Center like putting out stuff, and then the mayor then like retweeted what we did. But I'm like, that right there,
yeah,
that is a WHO code violation. That in itself
yeah.
is pushing formula, saying, making the assumption that you may need it. It's gonna be gone, even if you need it, just get it. And so they went and cleared the shelf of,
To
of whatever
create
we had,
a
and
yeah, to create the
hysteria.
perception of scarcity in a time
Yes,
of pandemic is just completely, it's dishonest, folks. That point blank, it
right,
is. But those are things that our families are experiencing. Let's talk about that. Let's talk about how in dual pandemics, right? So we're talking about a
right.
situation where there is a virus running rampant in communities, and families aren't sure, you know, whether they can go out and re-up, or, the things that they need.
Mm-hmm.
And we're talking about a global racial uprising that's occurring. So folks may or may not feel safe, may not be undergoing really traumatic emotional stress based upon what they're seeing happening in the world around them, depending upon what the skin color is right now. There's a lot that these families are experiencing. And so the propensity to take advantage of that and give them the idea that formula is the answer to their their troubles right now. Oh, it would just
Mm-hmm.
be so easy to get this particular formula. Or like we said, oh, there's a run on formula. They're running out, in case you might need
Mm-hmm.
it, go grab some. Any of those practices, any of those avenues of messaging, um, not only violate the WHO code, but have the potential to really just throw off a completely decimated breastfeeding relationship with families
Right.
who are already in this really vulnerable place. So we please again start put your comments and questions in the chat box. Let us know what you're thinking out there. We want this to be a conversation with you. Certainly, you all are having experiences that are different than ours, and we want to make sure that we mention those and honor those as well. But yeah, what are some other ways, audience, that the WHO code can be manipulated or violated during this particular situation that we find ourselves in as supporters in the world right now? Would love to hear from you.
Right. Do we have any questions, Angela?
Angela will let us know. But there's been a lot in the news about breastfeeding and the World Health Organization in the last couple years. Right before this call began, Nikki and Angela and I were talking about um, I guess it was a resolution back in 2018 at the World Health Assembly.
Mm-hmm.
We resolved that breast milk, is the superior infant feeding, and I believe it was that, marketing of substitutes is not okay, essentially. And
Right.
so many countries were running to sign on to that, except you guessed it,
Mm.
the United
Mm.
States of America. So that I think for me, and I've been, somewhat engaged through, politics in the last, few years. That for me was my first aha. Wait a minute, what? This is directly
Wait.
impacting breastfeeding,
Right.
the decisions of this particular
Right.
administration. And then it goes kind of, it's been consistent. You know that the United States is, you know, making departure from the World Health Organization. That's kind of in the works already. Some of that stuff is really relevant to things like this that are
Right.
meant to be stop guards and, you know, place parameters around the way that we engage
Hmm.
with formula companies and the way that families are touched by them. And as we walk
Right.
away and are, you know, reticent or hesitant to commit to anything that supports breastfeeding as a country,
Hmm.
I think negatively impacts our families in ways that have yet to be seen.
Yeah, I feel like if we lose that safeguard of the alliance with the World Health Organization,
Yes.
our WHO code, like that, the violations will increase. It won't even, people are like, well, we don't have to adhere to anymore because we're not with the WHO. And I was like, and just think about what happens with our breastfeeding rates. Think of what happened with hospitals as formulas start to leak back into
Yes.
doctors' offices. You know, people already walking in doctors' offices right now and seeing like mounds of formula there, and they're like, "Oh, we were just putting that up." Technically, that should have been put up before the patient even entered the room. Okay. So what is that going to happen? People are going to become really lax about it. And it puts us in a sticky position because we don't feel like we have the safeguard of any, you know, like a national or a really breastfeeding friendly advocate behind us supporting the work that we do, which is hard work, you know, especially in spaces where breastfeeding is not, the rates are not where they need to be. So it could make our job much harder.
I agree. Oh, Angela's got some comments to share with us. Come on, Angela.
Thank you so much. So yes, we have people, just to get back to your first point of where are people participating today. We have a couple of people from Louisiana. We've got someone from Florida.
Oh,
So sharing both of
Hey now.
you. We've got Maryland represented, the Piedmont area of North Carolina, New York City, sorry, Philly is the next one,
Yeah.
Philly. And
Philly. Okay.
then there's an Australian IBCLC who is tuning in from Liverpool. We
Nice.
also have
oh, cool.
Monterey, Nuevo Leon. We've got Charlottesville, Virginia here in my backyard. So really a lot of people who are joining us today. So on the
Fantastic.
Awesome.
comments and questions here, we have one person who commented, I wish the code would cover a wider area. Marketing tactics have become more intense and have changed a bit since it was created. The world isn't the
Hmm.
same as it was then.
Yep. Yep.
Y- y-
People are getting creative. They're getting very
Yeah.
creative
Yeah.
the way in which they're doing this.
Yeah, I was thinking that
So
too. Some of it is just so I don't even know what the word is. Subtle, so subtle that you don't even know that you're being tricked.
sneaky,
Um,
sneaky.
sneaky says my kids would say tricky, tricky. Yeah, so they're sneaking in this language and just barely towing the line of ethical in many, many ways. I would agree. However, I think there's probably an equally strong contingent that say it goes too far already. And that may be folks who that may be based in kind of an incorrect understanding of what the code is or how it should be used, how it should be applied. But certainly, I think there's folks who say, you know what, our families needs a mixed feed. They need to be able to have to compare across brands and see, oh, this one has DHA, this one has, you know, whatever. And they cannot, if the code is really applied effectively, because those types of benefits of them are not supposed to be listed. They're not supposed to imply that they have, you know, better anything over another brand, certainly not over
Mhm.
breast milk. So it's a conversation. It's a conversation for everyone who says it doesn't go far enough. Someone says it, you know, it goes way too far and is a deterrent, an obstacle to breastfeeding in their community. So we want to honor both sides of that conversation. I'd love to hear from
Mhm.
someone in our listeners here who believes that it goes too far, who believes that it's problematic. And you know, my experience has been more problematic in communities that are under supported already, that don't have great lactation support and education at the ready, and then it's really ripe ground for the marketers to come in and be manipulative, but it also again limits the family's options in terms of how they be able to really make wise choices for themselves or informed choices for themselves.
Very
Anything else,
true. We
Angela?
see some of the same things here.
So we have somebody who's asking, so there's a bunch of questions here. So someone is just clarifying the WHO code only applies to healthcare facilities. How about parents receiving free samples in the mail?
Then that actually is on the onus on the company. The company who
Yeah.
marketed the materials is who's in the wrong there. So yeah, it specifically calls out the way that families should be marketed to in hospital or care facility settings. But it also puts a great deal of onus on the companies that market their products and how they do so, however they choose to do so, wherever they choose to do so, is my understanding of it.
Well,
Yes,
and to that,
correct. Okay, go ahead, Angela. Sorry.
well, no, I was just going to say, when it comes to marketing, yes, it is the companies that should not be reaching out and doing that direct marketing to parents, right? You mentioned earlier the baby friendly and how they're not getting their diaper bags anymore. Well, the breast milk substitute manufacturers are insidious enough. Now what they're doing is they're going to obstetric practices and to pediatric practices, and they are passing out those bags there. And so,
Mm-hmm.
that is something which is definitely happening.
They're also getting contact information for families from mailing lists. You sign up for the Motherhood
Motherhood,
magazine.
maternity.
Yes.
Right.
All of a sudden you get your
Right.
welcome baby packet in the mail with formula from, whatever
Right.
company.
And you're trying to figure out where you got it from. You went and bought a nursing bra from the maternity store, and then you get some formula in the mail, and they're like, "How did this happen?" Or, again, like the baby magazines, they're getting it in there. So they're being very tricky and going around the back way, and still getting parents.
Absolutely. I think we
There's
cut you off, Angela. We got excited. I'm sorry.
no,
All right.
this is an exciting topic. It also, there's someone else here. How much are pediatricians influenced by the formula industry? They are so quick to suggest supplementing when a newborn creeps near 8-ish% weight loss. Any comment?
Listen,
So
Nikki, you want to answer?
I have a theory about that, in that I almost think I attribute it more to lack of education about breastfeeding. And
Yeah.
because in school they teach you about formula. You get all the formulas for the formula, and like how to give it, how to do all of this, and how much should they be drinking, and all these things. And so you're wired for that. So when you get in practice and they bring it, that's what you know. And what you don't know is the other stuff. And you're like, well, this is what I know, so this is what I feel safe with, when you actually have to do the work. And so it just kind of hooks them in. It's like, well, this is what I know, so this is what I'm going to go with. But obviously, there is the thing of, there's not as much money in breastfeeding as there is in the formula companies, because they have big dollars that, it's hard to compete with when you have student loans.
True story. True story. Listen, I've talked to pediatricians whose, entire medical school was sponsored by X pharmaceutical company that also happens to make breast milk substitutes. This particular hall, this particular
Mm-hmm.
auditorium, they saw these brand names all over the place as they were matriculating through their education towards supporting infants and families in the newborn area of their lives. So, yeah, they are exposed often and early to the benefits of formula feeding in a way that they are never exposed to breast milk education, and unless they pursue it. I'm really
Mm-hmm.
excited that ABM exists and is a thing, the Academy of Breastfeeding Medicine, as an organization of physicians who support and believe in the benefits of breastfeeding and endorse it with their patients. But they are not the majority of physicians, and these are physicians who
Mm-hmm.
sought out breastfeeding knowledge. And unless you do, as a pediatrician or other, general provider, any other provider, you really don't get this type of education, which is why we exist, I think. Which is why this has become a
Right.
professionalized role, a part of the healthcare provider team, because the other guys who do general support of families in a medical and a clinical way don't have this set of knowledge and don't have the time or opportunity to pursue it unless they make it happen.
Right.
Well, and to that point as well, I mean, am someone who, for LER, I have the privilege of attending many of these conferences and representing our organization. And it's quite sad when we are the only ones who are representing the breastfeeding world. In other words, and we're talking about, pediatric associations and
Yeah.
organizations. We're talking about dietitians. We're talking about not family practice physicians, but obstetric providers. All of them have the breast milk substitutes manufacturers who are at the conferences and who are buying dinner for people and giving gifts and everything else. And so, indeed, it's that relationship building that the breast milk substitute and the pharmaceutical companies are so good at doing. That really is what we are working against. So, and to your
Absolutely.
point, there's not a lot of money in breastfeeding.
Nope. Nope.
Yep. So, and I feel like even now, so even more so now that our providers are probably getting even more formula, now pushing it into their, like, oh, if they need anything, it's a pandemic, people are struggling, they don't have a lot of money, they may not qualify for WIC. So this is their place to get the formula that they need, when we should be pushing breastfeeding, coming out of the hospital, like, this is actually cheaper and more healthy for like, we want to give them breast milk because it protects them, provides antibodies and all those things. Instead of
Yeah.
pushing that package, they're pushing, here, we know that everyone's losing their job. We know this is happening. Take this.
Absolutely.
Very true. So there's a couple of comments here as well, if you don't mind. So one, I'm going to go off a little bit because
Oh.
this person asked the question a little while ago, which is, how have you handled parents' perceptions that COVID news stress can reduce their milk supply, so their babies, quote unquote, need formula supplementation when it's not even medically necessary?
So this is a
Um,
tricky thing, right? Because I think I do try to educate parents that their stress level can impact supply, right? We're talking about hormones and there's stress hormone and all that. So we talk about how to make sure that they can get to a place where they, um, connect with baby and are able to settle down for a moment to nurse, instead of, whatever hectic things are happening in their lives. So I can appreciate a parent's concern that their stress level is impacting their supply. What I try to do, while also affirming that that is a thing, we've already talked about the different pandemics that are occurring right now, right? So we've got the virus, and we've got racial uprising. We got a lot of things happening right now that can be stressful. Being out of work, all schooling other children in the home. So many things could be impacting their peace of mind. So that is real, and I affirm it. Then I try to shift to talk about ways that they can um, uh, remove milk more often, to help make sure that their supply is still strong, make sure they're not missing feedings, make sure we shift the conversation to things they can do, empower them, things that they absolutely can control. I think is a gift, in a good direction to go in. What do you think, Nikki?
I think this is a common perception that comes up, or concept that comes up during any type of disaster. And so when we worked on the infant ready kit, which is an infant feeding kit that we use during disasters, that we distribute during disasters, one of the things that, and then the training that we give at the breastfeeding center, is that this comes up in every major disaster, that families need formula because the families are too stressed to breastfeed.
Mhm.
And this comes up all the time. This is something that the media puts out there, and gets into brain control, everyone's mind, saying, you're going to be so stressed, you're going to be so stressed. And it's just not true. You can still make breast milk even in the midst of stress. So we just have to calm their fears and take them back to the basics of being a parent is stressful, all those things, it's stress. But we know how to help you through this. So utilize the tools in our community, the resources in our community that we have. But I tell you, this concept comes up we talk about this in our training. Every major disaster, cyclones, earthquakes, this concept comes up all the time, that families are going to be too stressed to breastfeed. And it is something that the media puts out there all the time without consulting with us, of course.
Very true. Okay, so a couple of other questions getting back to the code. Will the WHO code be updated from time to time? Is there any specific period between revisions and updates? If so, how many years?
The last resolution to it, I think, was in 2010. So I don't think that there's great rush, any sort of urgency around updating it at all. That's probably the extent of my knowledge. What you got, Angela?
Well, that's where the World Health Assembly comes in.
Yeah.
So it is the World Health Assembly who does come up with those resolutions. So the core of the WHO code is something that was written many years ago. However, there have been numerous resolutions since then. And so and many times, though, it's reaffirming that which we know to be true as opposed to. And so there's no specific as far as in any specific period as far as that appraisal and that review piece, but it is something which there are meetings on a very regular basis about the code and the scope of the code and other aspects to it.
Yeah, and I think that.
But also, go ahead.
No, I think it's possible that the way that it is worded now and was worded originally is still very much effective the world over. I think we have some specific challenges here in the United States where we probably could use some very specific, resolutions that are about us and our challenges that we face. What do you think, Nikki?
Yeah, and I was going to say, just keep in mind that if we disassociate from the World Health Organization, we may not be always privy to those revisions because we're not a part of the assembly, and we have chosen to look the other way. So that's going to be something on our own that we have to go and look and see, because it may not be readily available or advertised as such in our country if we're not a part of it. It's not going to be one of those priorities.
That's a good point. And we won't have a seat at the table, right? If the United States is not participating in the WHO code, then we won't have a seat at that table to have those conversations. So same person has an interesting question. Another question: can an IBCLC prescribe formula, meaning under utmost necessary indication after proper evaluation?
We just, if you are only an IBCLC, you don't have any prescriptive rights. You don't have any. We're not allowed to prescribe at all or diagnose.
Right. But if you're a healthcare provider, you can. They're the only folks that can prescribe formula or prescribe breast milk, human milk donations in the hospital. When you do that, they're the only people that can write on those orders.
Yeah. So it goes to your scope depending upon what role you're acting in with the patient.
Well, and I think it's also a matter of maybe the word prescribe. So in other words, IBCLCs do not, in many lactation support providers, right, they don't prescribe, they don't diagnose. However, if there is an indication, we can encourage them that the baby needs to be supplemented in some way, somehow. So I think that is, a little tricky. Now,
and have that conversation with their providers. Yes.
Absolutely. And to Nikki's point earlier, when she was, counseling that family who said, listen, we're being evicted. I got to pack these boxes. She didn't walk in with a 6-pack of formula in her bag. In other words, that would be really something where she then is influencing that person with that specific brand of formula at a time when they are truly at their low point. So she didn't do that. She's going to support that family, but she's not going to bring a case of formula along with her to those home visits, because that'd be pretty heavy with everything else you got to carry in there.
Correct. But in no case do I ever say a particular formula. I get these questions all the time. They're thinking, do you have a formula that you like or anything? I'm like, yeah, actually I don't. But I'll tell them, you have to find the formula that's right for your baby, and your baby will dictate which formula is right for them, because based on their gut health and their tolerance and all those things. So it's all up to your baby. And when I put it on that, then they go and decide for themselves. But the decision is always theirs. It's never mine.
Right. So, and when somebody commented, the AAP still has a relationship with the formula companies, and that answer is yes. Not only are
Yes.
they allowed to, the pharmaceutical companies attend their conferences and also support their journals to the tune, from what I understand, of several $1 million. And if that is incorrect, that's Angela Love Zarenka who is saying that. So
Blame
y'all can
Angela, the voice
come and
behind us.
have a conversation with me. No
Don't
camera, so
email
y'all can't
Nikki
see
and
me.
Nikki. Don't
No,
email
don't,
us.
no. Bother Miss Angela. So another question here, it has to do with WIC. A couple of comments about WIC.
Oh,
Someone saying
Mm-hmm.
WIC is needed, but moms know they can pick up free formula and that undermines their breastfeeding. And someone else says the US is the biggest purchaser of formula in the United States. And so any
specifically WIC.
comment? Yeah, any
WIC.
comment about WIC, Women, Infant, and Children, which is here in the US?
Nikki.
I think they're needed. I think there's a space for them, but I also think as much as they are trained in formula, I think they need to be equally trained in breastfeeding support. And that is what I see lacking in a lot of the offices that I go into. In that it's so easy to say, oh, I'm having trouble breastfeeding. They're like, well, which formula do you want? And so it's as simple as that, as opposed to I'm having trouble breastfeeding. Okay, let's get you into some lactation services. Let me counsel you to my full scope or knowledge. And then from there, let me get you into some community services. So I don't think that's happening enough. And I don't think they're really sticking to that and saying we are going to be breastfeeding. I've never heard them say we're going to be breastfeeding friendly. I've never heard them say that is something that they say we encourage it, but I want them to be just as for breastfeeding as they are for formula. And I don't think that's happening in certain spaces. It very well be happening in your space, but it sure ain't happening in mine.
So I think it's I agree. I think it's inconsistent. I think there are certainly some WIC offices that are doing a stellar job. They've got,
Mm-hmm.
peer counselors on staff that are rocking. I know for sure some of the LA area where I lived had some amazing peer support available, and support groups and all, just layers of support for families. Others not so much. And it's unfortunate because there are, I believe there was the last time I checked, additional perks for breastfeeding families, additional types of food they can get, where they can get
Mm-hmm.
organic and from fresh markets. They can get all sorts of these things are baked into kind of the bones of what WIC provides to families with infants. But not everyone knows it. It's not being, communicated at every WIC. And to Nikki's point, far too many are saying, what formula do you want? And I think that's a staffing issue. I think it's a lack of resources issue. I think it's a lack of consistency across the country, and it is unfortunate.
Yeah, and we've had the thing of creating barriers. Like some moms, they have to wait 6 weeks to get their pump. 6 weeks postpartum to get their pump. Like not everyone goes back to work at the time that the average time or whatever. Some people have to go back 3 days, and we need that pump. And it really creates barriers for the breastfeeding relationship that just shouldn't be there. They're just arbitrary and have no basis or anything like that. So I think when we get through a lot of that clutter and gray area, we'll have some better resources.
I happen to think that a lot of policy like that is created by folks who don't necessarily touch families. So it feels like we have a responsibility, those of us who do this work, to make sure that we're sitting at the table and a part of the
Mm-hmm.
conversations where some of this stuff is being developed.
Absolutely.
Good point. And to that point, here's a happy way to end the conversation with WIC is Michigan WIC has definitely come a long way. Our
Nice.
state now requires all WIC offices to have an IBCLC on staff. Our
What?
peer counselor program is going strong, and many peers are being allowed into their local hospitals and in collaboration with hospital staff. Yay.
That's fantastic.
That's
Thank you for
beautiful.
sharing that.
Great
So
job, Nikki.
someone has asked a question in the chat, and I know we have some people on this call who can answer this question, and so I'm going to ask it. I may know the answer, y'all probably know the answer, but just in case. And so the question has to do with when marketing is happening, when these subversive marketing practices are happening that are not in compliance with the code, and especially at these lower level and closed places, how are we to know and report? Meaning, does each country have a separate body to report to, or is there a common body for all countries?
So yeah, I
Um,
don't think the United States has anyone to report to because again, we have not signed on to the code.
We do. We do.
Oh, see, well, let you answer this, Angela.
Sorry. So in the United States, we have the National Alliance for Breastfeeding Action, NABA, N-A-B-A. Marsha
Yes.
Walker, exactly. Marsha Walker is, I believe, still the executive director. And so she does collect that information and she reports it to IBFAN, which is the International Baby Food Action Network, as well as to other organizations in different countries that monitor the code. And
Is it just
so
reporting or is it any is the response delivered or is it just for like record keeping reporting?
it's more for record keeping
Okay.
because in some countries they actually do have laws. So even a country who accepts the code and signs onto the code, if there's no legislation for the code, then of course there's no teeth and there's no way to
mhm,
not only monitor it but also to do anything about it. And so some countries have signed on but they don't have those regulations. Other countries, best practice is where you sign on to the code as well as enact legislation in your local area so that there are consequences for those organizations, and in those countries you will have those who monitor the code and can do that reporting.
mhm,
And so I just want to, I'm glad we're having this conversation because I'm looking here to see, as I said, there are a couple of people on the call who know the answer to that question. So if I got it wrong,
mhm.
please
Speak up, please.
please
Educate
speak
us
up.
all. Yes.
Yeah, I
Absolutely.
feel like the U.S. is kind of just sitting here in this space of who's going to check me.
Who's
It's,
going to check me?
who's going to check me? And it's okay. We could call out, certain organizations. They're like, but who's about to check me? Like, what's going to happen? And if nothing happens, if there's no, dip to your baby friendly funds or, all these types of things, then why would they adhere to only, but to me, it's what's best for the families. And that's what our ultimate goal should be, is providing the best care and resources for the families. So.
Agreed. Agreed.
And so someone has chimed in.
Oh,
The US has NABA. There are some countries with voluntary reporting and some with mandatory reporting as part of legislation. IBFAN's International Code Documentation Center closed last December, and there is no replacement announced as of yet. WHO, UNICEF have NetCode, which includes reporting tools that organizations can set up in their own country, even if there is no law in place. This can be a tool to begin the process of getting legislation. Thank you very much.
Thank you, wise and informed
Thank you.
listener. We appreciate that.
Thank you.
Disturbing
It was
update.
worse than we thought. We don't have anybody anymore.
Oh gosh. We are just running with scissors here. We are. Okay.
All
So,
blind with
so
one blind eye.
And we have someone, of course, another very wise person who has put the information about netcode, so I will pop that into the chat.
Thank you.
Someone else
Okay,
here is
cool.
saying the issue is the lack of monitoring and even more the lack of sanctioning for violations. Mexico has plenty of
Mm-hmm.
legislation in line with the code, but
But
no
no
monitoring and no sanctions.
so it has to be, all these things have to be in place, right? You can't have one part, not the other.
Right.
Because
Right.
toothless. Yeah. Yeah.
Right.
This is true. This is very true. And then so to kind of take a little baby step away from the code as people are still typing in their questions. Someone has a comment
Mm-hmm.
here. I'm struggling to keep information up to date with the constant new information about COVID, for example. I want to keep my parents and babies up to date with everything, but I'm struggling with, quote, fake news, like the meme floating around of a mask attached to a pacifier. Any suggestions? Also, what is the best way to keep up with information from the World Health Organization?
I have not seen that meme at all. I'm very concerned that that is a thing. But other than that, I think, look, I got excited, almost threw my headset off. I think our talk last week on fake news is very, could come in handy. 2 weeks ago, for this listener, we talked through a lot of the different sources of information that are just unreliable and what is reliable information. Nikki, you have thoughts on this one?
Yeah, and I think we referred to the World Health Organization, and they've been pretty firm in how they feel because remember, with the World Health Organization, they're taking into consideration all the countries and not just the U.S. And like I was telling the last time, I'm sure they have a special phone for us to call us up directly and say, "What are y'all doing?" So we have to make sure that we have to go to them, and they've been pretty firm that this whole time they should have been breastfeeding from the jump. From the jump, they said that families should have been breastfeeding, and even with COVID, they should have been breastfeeding and all these things. So if you want to go to more national organizations, we do have some of that in our talk from 2 weeks ago. But A1 has come on board. The CDC is we're creeping along, but also you have to adhere again to your state and local guidelines, as every state now is different. We used to be one, now we're all these different countries inside of a country. So go ahead.
Yeah. Angela, I think the latter part of their question was, how do we get the most recent information from who? Is that what they're asking?
Yes.
I visit WHO's website primarily to get the information I need. I feel like I get an email as well, but I can't swear to that. But they're pretty effective at pushing out information as well, even on social media. Hence the meme about 5G not being related to coronavirus. That was a social media campaign. So they're pretty effective in that. Anybody else have any other way that you get information from who?
And ILCA tends to translate the information pretty well from World Health Organization.
True.
Well, and I have found a new app that I'm pretty happy with. It's actually WHOA is the app, and it's from the World Health Organization. And they ping me every morning with new information. And so they have information here on case management, things that are outside of the scope of a lactation consultant, but they've got information on labs, maintaining essential health services, international health regulations, community engagement and communication, logistics, global networks. I mean, they've really got a lot of robust resources on the app, and it's relatively easy to navigate. And so I actually was thumbing through there, and I found something new that WHO had put out on breastfeeding June 23rd. And I was like, oh, I forgot about that. So there it is. So it was really nice.
Thank you. Angela, while I have
Thank you.
Can you share with the people the most recent news out of the World Health Organization regarding breastfeeding?
So as far as the code is concerned, absolutely. So a few weeks ago, the Global Breastfeeding Collective was notified of a new tactic that the World Health Organization is going to be taking, which is especially for those who manufacture breast milk substitutes, follow-on milks, bottles, and teats. In a nutshell, they're issuing a call to action to breast milk substitute manufacturers. This call to action will go out as a letter to the 19 largest sellers of breast milk substitutes and is asking the following: to commit to full compliance of the code and all subsequent resolutions and submit an implementation plan on how this compliance will be achieved, commit to supporting adoption of national legislation on the code, agree to monitoring of code compliance by ATNI and share information on internal policies to achieve the plan, immediately commit to full compliance of the code with regard to all products for 0 to 12 months in all countries, not just those deemed as higher risk. WHO has identified a 10-year time frame for making the necessary changes, recognizing that it will necessitate these companies changing their business models, losing sales, market share for some products, and needing to shift to development and promotion of other products. they are asking for a response by September, and there is actually a website, and I will pop that into the chat. So now that I have said all of that, what comments do y'all have on that?
So they want our grandchildren to be able to adhere to that. 10
Yes.
years? Come
Yes.
on. 10 years?
10 years.
A
10 years.
decade?
And that I think
That
was
just seems like a lot.
yeah. That was If Band's response, right, Angela? They were the dissenting voice there that says 10 years is just licensed to continue to harm children, babies for
Right.
another decade. Like, why would we
Correct.
My
give
kids
people
in
that?
middle school by then. I mean,
Yeah.
come
How
on.
many millions of infants will be born before, every company signed on?
Yeah,
There were
they'll
some
sign
that
up for
signed on
that.
right away. Yeah, they signed on right away. Nestle signed
Hmm.
on, almost immediately, right, Angela?
Correct. Almost immediately, like within an hour of the announcement, both IBFAN expressed their dissent. Their dissent is also found in the Meridian report, which is the report that actually came from the convening of all of the stakeholders in order to take this action. And so IBFAN, their dissent is recorded in both the Meridian document as well as they came out with a public statement. And Nestle, of course, came out with a statement saying that they were all in.
We love this. Yes.
They're
In
like, oh,
10
this is
years,
doable.
we'll
Totally
follow the
doable. We
code.
could 10 years? Of
That gives us
course.
10 years to figure out how not to follow the code. That's great.
Right.
Find
Let's find the
other ways
loophole.
around this. Yes. Yes. So, but we couldn't end the call without giving you the latest and greatest information about the code and how it's being interpreted and what's happening with it, right now in the field. Anything
Right.
else, Angela?
No, that's it. I do want to say, though, as far as the code is concerned, I think one of the reasons why they are taking this and having this conversation, it really has to do with trying to find the breast milk substitute manufacturers to get them to actually comply.
Yeah.
And they currently say that they are complying and that they want to comply. And yes, this does give them that sort of foothold in saying that they are in compliance. And look at us, we're talking to WHO, and we care about public health, we care about families and babies and everything, and continue their the predatory marketing practices until then. And so that's really it is sad, it is frustrating, and yet, from the pragmatic perspective, I can almost see the why of this, but I don't know if I'm bold enough to have, signed on to something like that. So it's a really tough, space to be in. I will say that if you want more information about it, and this is not intended, I was intending to mention this, but actually we are going to have a new lesson and a new instruction on this on the LER site in the next few months, because this is something that's not going away. We'll be able to watch this play out for the next 10 years. So I do appreciate all the discussion that's happening on both sides of the table. So thank you.
Absolutely. Absolutely.
Yeah,
Listen,
for sure.
before we go, we want to tell you about our next time you'll hear from us, which is August. Oh, I'm going to forget. August. Yeah, one of you keep me honest here. During the
Hmm.
first week of August, we'll be back to talk about World Breastfeeding Week, National Breastfeeding
August 5th.
Month. Thank you. On the 5th of August, you'll see us
Hmm.
again, and we'll be talking about how we're celebrating World Breastfeeding Week, what a lactation professional can do in their community, virtual or not, to celebrate World Breastfeeding Week and National Breastfeeding Month. So please tune in. Please send us, be ready to talk to us about your ideas, about how you're celebrating, and about ways that others can do the same. We want to have a sharing of ideas space right here next time. Anything
All
else?
right, everyone. Thank y'all so much. And we hope that y'all are being safe and being
Yeah.
well. Again, you can always catch us offline on LER's site or on Nikki and Nikki's site. So please keep us updated on what you're doing.
Yes. Share this talk with someone who needs it. The recording will be up soon. Take care.
All right, everyone. Bye.
Give me just 1 minute. Somebody just popped something else into the chat. HTTPS ibfan.org/monitoring.
Nice.
So if anybody
Thank you.
wants to, it says IBFAN is allegedly accepting reports of violations. I have no idea if they're able to compile the hefty reports they did when ICDC was up and running, but I will pop that in the
Allegedly.
chat and
Thank
leave
you.
everyone with that bit of hope. Thank
We
you.
appreciate that. Take care.
Bye.
Bye-bye.